Hey guys, welcome to episode 4 of Chasing Gains Radio. So we've got an amazing guest on this week. You need to listen to the whole podcast. I guarantee you will learn an amazing amount of stuff. So we're having Dr. Posture is actually on the episode today. He's going to be going through basically what causes, I would say, probably 95% of the injuries. So if people hurt themselves in the gym, generally it's not what they were actually doing that hurt them, it's what they'd done previously. So it's like the straw that breaks the camel's back, basically. And he's going to talk about the bone growth that people are actually having because of this bad kind of posture, and it causes all these injuries back of their heads. So the majority of people, I think he talks about 60% of the people have 2 centimeter bone growth in a certain population. That is not a good thing, and you don't really know what's happening, but we can kind of diagnose it, explain how to fix it, and he shows how to fix it with a very quick example of the manubrium lift, and it's basically a game-changing kind of thing. So be sure to watch the entire episode. If you have any questions, make sure to use the Chasing Gains hashtag, Chasing Gains Radio hashtag, to be able to get some questions answered by either me or Dr. Posture. Looking forward to an amazing episode. Cheers, guys. Chasing Gains Radio, the insatiable quest for constant progression. Chasing is the act of pursuing. Gains is the result or positive outcome. Chasing Gains Radio. Here's your host, Cody McAuliffe. Hey guys, welcome to episode 4 of Chasing Gains Radio. We've got an amazing guest today, which is Dr. David Shahar, who's a world-renowned chiropractor and expert on pain, posture, and biomechanics. So for the past 16 years, David has been lecturing and educating his patients, healthcare professionals, and other general population people on the proper use of the human skeleton. So his hands-on clinical expertise over time has led him to found Dr. Posture in 2008, and that was because he was noticing a constant trend with poor head posture. And he was looking to basically be able to solve that. So he also created some amazing concepts as well, such as the manubrium lift and the thoracic pillow, and the Stretching for Life program. So he's really making a difference within the health and fitness industry. He's also a creator of the training series Biomechanics, Pain and Posture for personal trainers, which is actually how I got in contact with him. I did that course, and it was an amazing course, and it's where it sparked my passion for improving posture of both myself and my clients. So thanks, first of all, David, for that amazing course, and welcome to the show.
Thanks, and thank you for having me.
Awesome. So do you mind just giving us a bit of a background about your history kind of in the chiropractic and health and fitness industry?
Yes, so obviously, I was always a physical individual. I really love sports and exercise, and it's my passion actually. And I gravitated towards a healing profession that is, in my opinion, quite practical, mechanical, hands-on type of thing with natural spin to it as well, which is chiropractic. My goal throughout the years that I've been practicing is to empower my clients, and then get them to become more and more independent when it comes to caring for their posture and taking care of themselves. Through working with people on pains and tightness and disabilities, I have noticed that while individuals suffer some severe trauma, acute traumas and injuries, the vast majority of individuals I've been working with have been mostly experiencing pains and discomforts due to repetitive type of stress, repetitive type of trauma. And as we live our life these days, with computer-related activities, being very sedentary as we are, the influence of poor posture on our health becomes quite obvious in a detrimental way, unfortunately not in a good manner, and we're using our bodies in a way that was not intended for it to be used
Yeah.
For prolonged periods of time.
Yep.
And the danger of developing disabilities, discomforts, stiffness, and so forth due to a cause that develops slowly over time is that it's very difficult to later on pinpoint to it and say that's the cause.
Yeah.
And so therefore a lot of individuals are looking in circles and trying to blame specific things they've done or acute traumas they can remember.
Yeah.
And the neglect oftentimes the quite obvious thing, which is the repetitive stress that causes trauma and damage to the bones, joints, muscles, and so forth.
Yeah, for sure. So how would you define posture then?
Ideally, a good posture is where from the front we are quite symmetrical and balanced, where our head is in the center and the shoulders are fairly even in height.
Yep.
Not rotated forward or backwards. Same thing with the pelvis, and the feet are, normally should be straight down on the ground.
Yep.
It's such a simple assessment when it comes to looking at posture, but also over the years you just forget how many things you take into account. I mean, when I look at someone's posture from the front, I start at the feet. I want to see that they don't have a fallen arch in the foot that drags their knee in and creates a knocked knee that causes damage to the knee because then the knee is not balanced and the loading on that joint is not the way it should be, and therefore wear and tear can be there. Because of problems in the knee, there could be problems in the hip and the pelvis, and therefore creating even a scoliosis in the spine. Leg length discrepancy could be an issue that causes these kind of problems as well, where the spine is not symmetrical and straight as it presents itself. So on one hand it's very simple, on the other hand we have to look at so many components to understand the posture from the front and pay attention to any of them and all of them, because any of them could be causing a problem which eventually going to be translated into pain. From the side view, when I look at an individual, instead of looking at them from down up, I normally look at them from above down. And it might have been different years ago, but today, because of our activities with computers and phones and technologies, one thing that I commonly see is that forward head posture dictates and determines what's going to happen with our chest and with our lower back and the rest of our body. So because of forward head posture, I see a posterior weight bearing of the chest and the lower back. Ideally, obviously, we would like to see the head resting on top of the shoulders and on top of the hips and on top of the feet. So basically, we are effortlessly resting the weight of our body on our bones. That's ideally, but in reality, what I see a lot is that people carry their head forward sometimes substantially, sometimes substantially more forward. And in response to that, they have to shift some weight back. So they shift the chest and lower back backwards. What they do in response is they compress their lower back, their abdominal and chest organs, and also as a result of the fact that the weight of the head is forward, instead of resting the head on the bones, it is resting on the muscles. It immediately, as soon as you shift your head forward, you're engaging the muscles at the back of the head and in the shoulder blades. And so these muscles undergoing an isometric contraction through the day, preventing the head from descending and resting on the chest. And so a lot of stiffness can develop as a result of that. Other issues that can develop as a result of that is also an extension of the head, of the skull. because if you want to stare at the computer in front of you and you have a forward head posture, you have to extend. You have to extend your head exactly so you're creating tightness right underneath the skull, so the suboccipital muscles.
Yeah.
A cervicogenic headache, for example, is a common development, a common symptom that we see recently emanating from that incredible stress that is exerted for prolonged periods of time at the posterior cervical spine and underneath the skull.
Yeah.
Yeah.
So
I know that I probably have not been so organized in going over all these problems with posture, with what I look at and why I look at it, but I think...
Yeah, so it's a general overview. Notice things that also go kind of have referral problems throughout the entire chain of muscles. So when you're looking from the front on, you start at the ground up. So that means that like if someone has a leg length difference, then they're going to obviously have ongoing problems. So I have like a leg length difference, it's 13 mil or something like that I had since birth. So it means that my knee goes in on that side, my hip goes out on that side, and then I have scoliosis through my back as well. And like there's no real way to be able to tell that unless you go kind of see a chiropractor and get that kind of tested. Is that right?
Well, you need to have a thorough assessment. An assessment can be done by other professionals as well.
Yep.
Unfortunately, though, if your mind is not set at the get-go to look at posture, oftentimes you might ignore that issue.
Yeah.
So long as the person bears in mind, I mean, because palpation can be one way to an observation.
Yeah.
And it could be one way to look at posture, and all the way to doing X-rays, which is what I do here. I take X-rays and I see the leg length discrepancy by measuring the top of the femur. And then I look at the pelvis and see if the pelvis has rotation in it, if it is tilted to one side or another. And oftentimes, very often, what you'll see is the side where the hip is shorter, that's the same side where the pelvis is going to be shorter.
Yeah.
The spine is going to lean toward that side to start with at the bottom.
Yeah.
And create compensations all the way to the top.
Yeah.
So that means that the muscles cannot work symmetrically. That means that some areas in the spine are undergoing more pressure. Some areas of the spine are undergoing more stretch.
Yep.
And so wear and tear is normally going to happen faster, whether it is to the soft tissue or to the bony tissue, because areas of compression on the bone normally over the years will start deposit calcium and other minerals to build up that bone, so because of the excessive stress on that bone.
Yep.
That's how spur formation begins, and that spur formation in turn can cause, depending how big it is, it can cause either fusion of segments or impinge on structures such as nerves and other structures and cause pain. Unbalanced stress on the disc can also make the disc bulge, because if you press on the disc on one side, you're pushing it towards the other side.
Yeah.
It can create damage to the disc itself. The disc itself can in turn grow and put stress on the nerves. And what's really fascinating about all that is that it's also simple and easy to understand.
Yeah. You have to know to look for it, though, I guess.
Yeah, you look at the X-rays and you see it white on black and you can understand it. What is very elusive about all that is that pain doesn't develop rapidly. It's not the first symptom. Sometimes the first symptoms is a postural imbalance, or maybe tightness or stiffness. Not necessarily pain or acute pain or pain that radiates down the leg or down the arm. And as a result of that, with the absence of pain, people ignore their problem. And I always refer to that as I draw the parallels between tooth decay
Yeah.
and spinal decay.
Yeah.
Because you can have decay in your tooth developing over years,
Yeah.
Months or years, and you wouldn't even know until it hits the nerve. Then, of course, you will know, and the story is quite obvious of what's going to happen next.
Yeah. Cool. So, do you think pain is a bad thing then?
So we differentiate between. There are many kinds of pain, but generally speaking, an acute pain is a good pain.
Yeah.
It's a pain that tells you you've hurt yourself, be careful.
Yeah.
So whether you put your hand on a hot plate and you need to pull your hand off of it, or whether you cut yourself or on a sharp object. So acute pain is a good thing. I mean, without it, we would have hurt ourselves badly.
Yeah.
Throughout our lives many times. Chronic pain is something that most people, myself too, see it most times as a bad type of pain.
Yep.
It's something going wrong.
Yep.
The body is nagging you and telling you, look, something is wrong, do something about it.
Yeah.
And there are different ways in which people deal with their health, and I don't really pretend to. I just really want to say that I don't want to judge everyone because they have different experiences in life, but it's just like everything else. Some people are going to smoke until they're told they have cancer, and then they're going to stop. Some people are overweight until they're told, you have diabetes or heart disease, and then they're going to change their diet. And when it comes with bone decay and its influence on the nervous system, causing pain and discomfort, numbness and tingling, and other disabilities and stiffness, unfortunately, I see oftentimes that people wait until they have, first of all, a severe pain.
Yeah.
And secondly, oftentimes when they do have the pain, they don't know how to manage it in a functional way. Yeah. So I'm not going to tell you that medications are not important and surgery is not important. They're extremely important, and sometimes are the only way to control a problem. But the vast majority of individuals dealing with pain are individuals who can control it and improve it and defeat it by simply improving their structure, the posture, how they do things.
Yeah.
When we're talking about obviously structural type of pain or musculoskeletal related type of pain.
Yeah.
So I see that there is a lot of misunderstanding out there, sometimes even by practitioners, and if there is an inflammation, take an anti-inflammatory. If there is, and like I said, if I couldn't sleep at night, I'll probably take a painkiller as well. But the morning after, I want to know why the pain was there, and I want to treat it for what it is. If it's a mechanical issue, I have a mechanical solution for it.
Yeah.
And if it is a chemical issue, I'd like to have a chemical solution for it. So I deal with mechanical problems. The skeletal system is a mechanical system, and it has an effect on the nervous system, which lets us know when the musculoskeletal systems are behaving badly. But oftentimes it's not in the early stages, and it's in the later stages. Yeah. And if we identify in early stages through screening, I draw the parallels again with dental hygiene.
Yeah.
You don't wait until you have a tooth decay to brush your teeth or to floss. And I think that when it comes to posture, it's important to have to maintain good posture. It's really easy to do too. It's just something we need to be attuned to and aware of, and teach ourselves maybe to start with. But once it becomes a part of what you do and who you are, you don't need to worry about it anymore. It's going to happen hopefully all naturally.
Yeah, for sure. So pain is kind of like an alarm then, and that's kind of also the end point rather than kind of the start. So if you can kind of get on top of it early, you're not going to end up getting that pain as well. So is that about right?
That's how I see it.
Yeah, great. Because I have a lot of clients that actually come to me and they want to get like amazing results in the gym, that kind of thing, but they start in a position where they can't actually move properly, their posture's horrible. So when they try and do certain exercises, they don't have the movement kind of patterns to be able to exercise at a high intensity. So you need to kind of bring them back to that and then bring them forward again, take like a couple of steps backwards to be able to get their posture right, get their movement patterns right, to be able to do the exercises and actually get the results from there. Do you kind of find that with your clients? Do they kind of just come in and be at a point where they think they just need to get something just to relieve the pain, basically, rather than stop the cause of the pain?
Yes, yeah. And I just want to point out, too, to start with, that, I think that people who come to see you oftentimes are very concerned about two things, and they would like to improve two aspects of life through you. One is their appearance, and two is their health. And obviously, improvement of posture, I see it as it contributes to both.
Yeah.
But we both know that for a person to, say, improve their health or their posture, let's say that you want to lose weight, let's say that you want to take your diet under control, you can't do it for 2 months, eat better for 2 months, and then say, okay, I've improved my eating habits for 2 months, and then now I can go back to how I was before.
Yeah.
And, you teach them basically about, getting things up to speed and then maybe having some level of maintenance.
Yeah.
When it comes to posture, the type of intervention I see working effectively is similar.
Yeah.
Where basically we get individuals to learn about their posture, have the type of intervention that helps them get rid of pains and symptoms, and once that's out of the way, give them the tools to learn how to improve their posture through exercises as well as through some simple cues, maneuvers that they can mostly do at home. And occasionally they'll come for, we call it a tune-up, if you like, and get adjusted. And that's like the, how you take the braces off after they've been there for years.
Yeah.
Then you have that retainer that keeps things in place.
Yeah.
It's not as aggressive, but it has to be there so things don't go back.
Yeah.
And
Okay, cool. So you talked about the posture and appearance. Can you go into a bit of detail about what the effect posture has on your appearance?
So obviously, you see individuals sometimes take really good care of themselves. They invest a lot of money in their hair. They buy good clothes, and we all want to look good. I mean, why wouldn't you want to look good? It's I'm the kind of person that if I can improve myself, that's what I want to do.
Yep.
And so looking better is one of the ways you could do it. And so what I don't understand is that why would you say invest so much, whether it's money and time and thought about your appearance, and then sit like so?
Yeah.
And that is not appealing to anyone. It is. I see that so frequently, whether it's my patient sitting here or whether it's when I'm outside at the shopping center or somewhere else. The transition, the transformation coming from this type of a posture into here is so simple, and it adds so much to your appearance in terms of the level of confidence you have, and so forth. It looks better. What is really obvious to me is when sometimes parents come with their teenagers, kids, with their teenage kids, to come and help them with their posture. And they see how in an instance that child posture changes with the cue I give them.
Yeah.
And they just stand there and they just can't believe it.
Yeah.
How the child's posture have not only changed, but it changed their appearance and made them look different. I clearly remember a parent one time literally nearly tearing, saying, "My daughter is so beautiful." I know, but why are you saying that? And she goes, "Yeah, I mean, her posture. I mean, she's standing so differently now."
Yeah.
It's so simple. It's so easy to do, yet it is so impactful.
Yeah. Yeah, so they've done some studies on it as well as a TED Talk on power posing. Have you seen that?
Yeah.
So they talk about going into like an interview or something, and if you just basically stand in a power pose before you go in, it actually changes how you think about yourself before you're going into the interview, and you end up being a lot more confident just because of your posture, how you stand, how you hold yourself, and a lot. They did like tests of people so that the ability to gamble, because obviously you have to be very confident to gamble, and they actually tested their testosterone levels before and after, and their testosterone levels, which kind of relates to their confidence, actually increased after they'd done the power posing to be able to change their posture to do that. So the posture kind of affects their mood and how they feel and stuff like that. So I'll probably post a link to that in this thing as well, so people can check that out as well. So what are the current issues that you kind of see with posture at the moment? What's the main thing? So you mentioned forward head posture. What are you kind of seeing with that at the moment?
So I think that that is the main thing. Again, it's important when you look at posture to evaluate the frontal view, or you look at the foot, the knee, the pelvis, you look at the spine, you can look at them from the back and check to see that the angles of the scapulas are not different and that they are symmetrical, and therefore, as a trainer, prescribe exercises that are going to stretch the tight side and strengthen maybe the area that is not as strong, not performing as strong, and so forth. But you know, that forward head posture hits really hard and at all age groups. So I have, for example, compression fractures in the thoracic spine are commonly seen with individuals who are females, advancing in age, large frame, and wide. I mean, when you learn the differential diagnosis, I mean, these are the things to look for. I mean, compression fractures, you look at these type of profiles. You know? What I see recently is I see young adults. I'm talking about 28 years old, or early 30s, 32 years old. Males with big frame, which is practically the opposite of what we used to consider as the profile for a person who's going to present with compression fracture in the thoracic spine. So I started seeing that quite frequently, wedging of the vertebrae in the thoracic spine of these individuals. And again, I would attribute that to sitting in front of the computer with the head posture compressing the thoracic spine. So my recent research, we just actually submitted a paper to the Journal of Anatomy, and it looks like it's going to go in because we've already heard back from it. And that describes the formation of bone spurs at the back of the skull of young adults. So we've looked at 218 18 to 30-year-old individuals. 41% of them had a bone spur growing from the external occipital protuberance, measuring more than 10 millimeters.
Wow.
And 10% of them had a bone spur measuring more than 2 centimeters. The largest one we've measured is more than 3.5 centimeters. Can you imagine a 3.5 centimeter bone spur growing at the back of the head?
Yeah.
And so it is, these bone spurs are growing inside the anthesis, the insertion of the trapezius into the back of the skull. And as a result of the excessive stress, there is deposition of calcium to strengthen the insertion, so the stress is distributed on a bigger area on the skull, on the bone. And, you know, when you look at, and that's what we're doing for our next paper, I've already looked at about 800 individuals, and amongst them are individuals over 70 years old. They don't have that, or not nearly as frequent and not nearly as large spurs forming in the back of their skull.
Yeah.
And you know, it's puzzling in a way, because if you know about bone spurs grow larger over time.
Yeah.
And you should expect that they will show more. They'll be more frequently present in the elderly population versus the young population.
Yeah.
And so, so we understand that there is a massive amount of stress now at the back of the skull, unlike there was before. So there is a lot of stress exerted on the skull, a lot of stress exerted on the thorax at the front, and a lot of stress also exerted at the lower back, because people sway back to counter that forward head posture. So I think you were asking me about...
so what do you think causes all of that, the spur formation then?
Yeah, so, you know, from as a chiropractor, a clinician, as a person who is just observant, it's I can easily tell you that it's the introduction of the use of screens, or handheld screens, whether it is games or phones or tablets and so forth. From a researcher point of view, I have to say we have to study that. And so we are actually working on that one, and we're going to publish a paper about that too. But I just want to say, you have to ask yourself a simple question: what have changed in the last 10 years to bring upon such a big morphological change at the back of the skull of young adults, something we haven't seen before. And if you're going to think hard about what have changed in the last 10 years versus the years before, I think that you'll come to the same conclusion.
So everyone's just on their phones like this all day now, I guess.
And they create traction on that insertion. Tractional forces on that insertion. And again, studies have shown that repetitive stress is mostly responsible for the formation of bone spurs and damage in bone and joint, more so than acute trauma. Which normally heals.
So the majority of people coming to you with like acute trauma, or is that kind of repetitive, stressed kind of stuff that they're coming to you for now?
So, look, the majority of them come and complain about pains that they had, started a week or two ago. Most people. The pain is not always, although I do have people walk in with someone else's help because they're in acute pain. But the vast majority of them will tell me, look, I've had this pain over the last few weeks and it's getting worse. I thought it's going to go away by itself. I've taken Panadol, I've done this and that, and nothing. Did you fix it? So, and so that's going to be the way they're going to present. In terms of whether or not the cause for it was a major trauma or an acute trauma versus a repetitive type of stress. I guess each case is different, and sometimes what happens is that a repetitive trauma will render an individual prone to an injury in a certain area, and then say they went to the gym and just did an exercise that should normally not cause issue, but with them, because they have repeatedly stressed that area over weeks or months or years. Now that area is more prone to injury, and they've injured themselves doing something benign, that lifting a weight in a way that would not hurt someone else.
So it's like sense? The straw that breaks the camel's back, basically.
That's exactly right. And so they'll definitely blame that particular thing they've done. Yes, I went to the gym, I lifted that thing, I was gardening this weekend and I lifted the bucket or the wheelbarrow, and that's what caused it. And you take the X-ray and then you see a bone spur like this thick, and you go, that did not develop over the last week or two. You know?
How do you find obviously with X-rays it's very easy, but is there any other way you can kind of lead people in that direction, kind of saying, well, like, because I see it all the time with people in the gym, they'll come to me, they're like, I'm kind of getting pain in my shoulder, and so I normally just do like a functional assessment on them, and then I'll say, this is kind of, you're not moving correctly, so your movement is actually causing that shoulder problem. So this is the kind of the process we need to go through to fix that. But they just kind of go back to what they were doing before. How do you kind of help people understand that they need to make changes with their movement to be able to get the results that they're looking for, because they've basically just maximised their potential for the movement that they're currently doing?
In terms of the diagnosis, it's multifactorial basically, because there's some orthopedic tests, there are some passive range of movement activities you could do for them to, and some of them can be complicated and should take into account other regions as well in terms of, the analysis of the problem. I mean, you have to look at also some neurological symptoms that they may be coming in with and so forth. For me, as a chiropractor, I enjoy the benefit of having all those components available to me. I can do the assessment, the physical assessment, I can do the observation and see what the posture is like, I can check the range of motion, I can do the x-rays here, and I can offer the solution. I think that in a gym setting, it is much easier for you to deal with more, say, not acute issues, but pointing out the obvious to them. Many people think they have a good posture, they just don't know. They don't. And so having them stand in front of a mirror and pointing out to the discrepancy in height, the leaning of the head to one side or the other, and put their hands on top of the pelvis, see how it's more forward on one side versus the other. That way you're pointing out the issues to them. You then have them stand with their back to the wall. So I'm not going to talk right now just about a specific, say, shoulder injury or whatever. I'm generally speaking, I just have them stand with their back to the wall, and I have them just translate their head back. And oftentimes they're really surprised, wow, that shifted back quite a bit. It could be 2 centimeters, it could be 3 sometimes. And they will also notice that it's really uncomfortable for them to do that, to shift the head back. And so you point all these up to them, and I normally take that opportunity to introduce to them a simple maneuver that could also help them out with their posture. It's almost a magic bullet. I don't believe in magic bullets, but it's as close as possible to one when it comes to helping posture. And as they are uncomfortable retracting their head back against the wall, I ask them to touch that bone at the top of the sternum, and I let them know that is the manubrium. And I call that the manubrium lift. I ask them to just lift the manubrium straight upwards. And as they lift the manubrium up, what they find is that their head automatically shifts and touches the wall. the shoulders flatten. I mean, the thoracic spine, the thoracic cage at the back, it flattens, so it's not so rounded, and the hump is reduced dramatically.
Yep.
And that swayed back also shifts forward. And so I like that because that means that instead of me teaching them what to do with the pelvis, abdomen, shoulders, neck, and head, I just tell them lift your manubrium, and then all those areas respond respectively to that shift. Why that shift is good too is because the manubrium lift makes all parts of the body shift simultaneously. So if one region is not sitting properly, or on top of others, if you just shift it, it will feel unnatural and uncomfortable because, you know, it's not in a vacuum. Some compensation is required underneath. And when you do the manubrium lift and you shift it up, you will find that as the head shifts back, the thorax shifts forward, the lower back lifts up and forward. And therefore, all the regions below are accommodating the shift above. And that feels really comfortable and natural. And it looks good. It looks natural. It doesn't look as if it is, you know, when you just draw your head back and it you know, uncomfortable.
Cool. So how often should people do the manubrium lift then?
Throughout their life.
What
I've done is, it's one of those things, you know, it's, if you're here, and that's not healthy, and it doesn't look good, and this is healthy and looks better, why should you ever want to be here and only occasionally be?
True.
So I ask individuals to always observe that manubrium lift. Tell their family members to help them remember that. So if the family members see them slouch, let them know, I really would like for you to, you know, remark to me, and they look at it not as a nag, but as a, you know, as them caring. And so if I do have a couple who are clients, you know, they get to just agree with each other, that they'll remind each other. I also have created an app. It's unfortunately working on Apple only for now, but we'll make it work with with Androids as well. But it's just called Dr. Posture and DRPOSTURE. And so on it, people can see a link to a video, the manubrium lift video, which explains exactly how it's done.
That's how it comes up.
Thank you. There it is, the manubrium lift. And the orange portion there was the reminder. They can set the reminder, they can switch it on. And they could, once they switch the reminder on, they could choose how frequently they want it to work. And from what time to what time of day. It's all free.
Awesome.
Meanwhile, if you don't have an Apple product, you could just go on the internet to my website, drposture.com.au, and watch the videos there that explain about, you know, the manubrium lift. You know, since we're probably talking to individuals who exercise a lot, I just want to say too that I also let individuals know that, for example, let me just give you a visual. Okay. Imagine an Olympic weightlifter. And they're coming to the weight and they're just about to lift it from the ground. Have you ever seen an Olympic weightlifter doing that when they're actually slouching, bending forward, and then pulling the weight out? So the first thing you see them do is, as they grab the bar, they lift their chest up and extend their lower back. And they extend their lower back. It's almost, you could say, they're doing the manubrium lift on there. Then they snatch it and lift it up and so forth. And I tell my clients that whether you're pressing, whether you're pulling down, no matter what you do, keep that manubrium lift and do it that way. And you will feel a lot more freedom in the movement of your shoulders. And you feel a lot more comfortable. The load on your body is going to be, the body is going to be subjected to that load in a healthier way, I think.
Yeah.
It's something to try. Everyone must try it at the gym and see how they feel when they do the manubrium lift through doing their exercises, whether it's weightlifting or even running.
Yeah.
Because when you run and you lift the manubrium lift, the breathing becomes
you can expand
easier.
your chest more.
You lift the pressure of your chest and you can breathe more easily.
Yeah.
I find my stride become larger because I'm stretching my whole body.
Yeah. I've got like a client who does 400-meter running that struggles with a bit of like rounded shoulders and stuff, and just being able to kind of get those shoulders pinned back, do the manubrium lift while she's running. She can get a lot more oxygen in, especially like for 400 meters because you need lots of oxygen. It really helps, so it's really beneficial in that way, and you can kind of transfer that across to any kind of exercise, as you said, and it really helps. What do you think about, so obviously people, the primary cause is people either on their phones or working at a desk. Do you think that standing desks are beneficial, or?
Yeah, I do think so. I think that they get us to move around a bit more, which is also good for our circulation. It's good also because, being sedentary, our hamstrings become shorter. Our hip flexors, the psoas, are shorter as well. And being able to stand and move about is better. Here at the university, where I do my research at USC, they've introduced or they've offered many of the faculty and staff the use of convertible type of a desk, which can either accommodate a seated position or standing position. If you're an individual who is going to be on the computer only an hour a day, which is, I guess it's not going to make a huge difference for you. But if you're the type of individuals who is 4 or 5 or 6 hours a day in front of the computer, you might actually want to consider using a desk that allows you to stand while you're using your technology, your computer, and so forth.
Yeah, for sure. And you still want to do the manubrium lift while doing that as well, because you can still hunch over, can't you?
Like I said, magic bullet.
So, like, I've looked into a couple of studies. There's actually a company in the US. This guy, have you heard of Kelly Starrett? He's massively one of the kind of biggest physio guys in the world that does a lot of people with a lot of stuff with CrossFit in the States. He's trying to get basically every school in America to start having standing desks, just because, especially with kids, now that they're spending so much time actually on computers and stuff as well at a young age, their posture's just getting really bad. And some of the data that he's kind of put out is that if you have kids work at a standing desk, they have a 60% less chance of being obese, just because they're actually moving around and they're not in that bad position, and their posture doesn't deteriorate over time while they're nice and young. So it just keeps them moving, and it actually decreases that chance of obesity and keeps that posture good. So that's definitely something that I'd like to see coming in Australia as well. So with the other solutions and stuff like that, so you have a product called the thoracic pillow. Do you want to explain that a little bit?
Yes, so the thoracic pillow is it's a simple product to use actually, and it extends so it can one size fit all kind of, because it could be stretched out. The idea with the thoracic pillow is that it reverses the normal slouch. And like I said, when I work with my patients, with individuals, I always try and think, how can I make their life easier? How can I make it more simple for them? So hence the manubrium lift, it's so easy to perform. And when it comes to tractioning the spine, after sometime hours on end where we're in flexion, some extension won't hurt. The thoracic pillow pushes this weight back forward. it opens up the chest. It has cuts that allow the scapulars to drop back and open the chest from the front.
Yep.
Importantly, it is supporting the bottom of the neck only,
yep.
and not the top of the neck. The top of the neck should be suspended over the edge of the thoracic pillar, and the reason for it is because we need to have a lordotic type of curve in the neck. A
yep.
lordotic curve in the neck, if you're facing this way,
yep.
gives you elasticity, and it brings your head to rest right back on top of your spine as well. But it gives you elasticity as you're using your body and as you're running or walking.
Yep.
If you're straight, you're going to have axial compression causing damage.
Yep.
And if you're reversed and too forward, you will be loading on the front, causing an extreme stress on the muscles at the back of the neck and in between the shoulder blades.
Yeah.
So the thoracic pillow, the advantage of it is that it addresses all regions of the spine simultaneously.
Yeah.
And just like with the manubrium lift, you see, if you just move your head back, it will feel and look comfortable. But because we're doing the manubrium lift and we shift our head back, flattening our thoracic spine, driving the lower back forward, same thing with the thoracic pillow.
Yeah.
Because it addresses all parts of the spine simultaneously, it's actually quite comfortable to use.
Yeah.
Awesome. People who are users say that they oftentimes look forward to get onto it and have their daily stretch, 10-minute stretch.
Yeah.
To help the posture.
Yeah, awesome. Are there any exercises or stretches or anything that you can kind of recommend to help improve posture as well? So you've got the manubrium lift, you've got the thoracic pillow. Are there any kind of exercises or stretches that you'd recommend as well?
On my website, I also have and on the app, free to download posture exercises.
Yep.
So I recommend for everyone to do, first and foremost, just simple warm-up exercises, which are just simple stretches of the spine in every direction, so rotation, flexion, and extension, and so forth.
Yep.
They can be found, that PDF is free and could be found on the website. The next set of exercises presented there is stretching of the lower back, strengthening the abdomen.
Yep.
I also have exercises there that where a rolled towel is placed against the shoulders, and the individual is encouraged to press their neck right back against the rolled towel.
Yep.
And press back with flexion, lateral flexions, and then press back with rotations to strengthen the extensors of the cervical spine.
Yep.
I also have a couple of sheets there that are dealing with stabilizing exercises for the shoulder girdle and the pelvic girdle,
yep.
and core strengthening exercises, simple planks. So I think these exercises are important. I think that it takes only minutes a day for anyone to perform them.
Yep.
And oftentimes individuals who do heavy exercises will isolate regions,
yep.
and they work on a particular region,
yep.
And never actually attend to their whole body,
yep.
and do a whole body exercise. What ends up happening is that they have a lot of strength, but they don't necessarily have strength in between the regions,
yeah.
in the core, maybe as much as they should have. And therefore, these particular simple exercises are probably good, not just for the, say, aging individuals who need a very simple routine, but they're also very good for individuals who are heavily into bodybuilding and so forth.
Yeah, awesome.
The last week was really exciting for us here because we're pretty sure we're going into the Journal of Anatomy, which is going to pave the way for all the next programs that or research papers that we're putting together here. And I think that once all those papers will go in and publish the linkage between the damage that is occurring in the spine and posture is going to be very easy to draw. Because that individual you've mentioned from the US, I don't know him, but part of the problem that he will encounter is that he needs to show proof that there is a problem, first of all, before people are going to put money into the solution. And that's why, although I have ideas and I know what should be done, say, at schools and workplaces, I have to, first of all, draw the link between the problems and symptoms and actually poor posture, and show that this is the cause. And as I said on the podcast, it's one thing to say it as a person or as a chiropractor, you could say it. But as a researcher, you don't say it until you know it. And those people who are going to invest any money into it would like to know, not to speculate or anything like that.
So they need to seek proof.
So we're heading in that direction of compiling all the necessary information to prove that mechanical reasons are there for, pains and damage, and that prolonged sitting and slouching is part of the reason why these occur, and show the solutions as well, and show that they've been tested, because we're also testing all those solutions at the lab. The thoracic pillow is being tested at the lab. We're x-raying students before and after. As well as with the manubrium lift. That's already done, actually. We just need to write up and publish that. So.
Awesome. Doing some great work then in the fitness industry. It's always good to work with people who are looking to make some changes, and you're certainly working towards some great outcomes in the fitness industry. So it's always inspiring to work with people like you.
Thank you. And let me know if you hear any feedback.
I'll normally what I do is I'll do like an introduction at the start where I just record kind of what we actually go through on the podcast. And then I normally get people to just post on my Facebook page if they have any questions in regarding to the thing. So what I'll do is if there's any specific questions, I can just send them to you. And then you can get them answered then as well. So it's always good to have that interaction with the people who are listening anyway.
Yes, sounds good. Thank you very much.
That's probably about it for today. What's the best way for people to get in contact with you? Is it through your website or on Facebook or...?
Probably the website, it's drposture.com.au, which is drposture.com.au, and they could the contact form there they can reach me that way.
And you're on Facebook and Twitter and stuff as well.
I am. I just I don't remember my.
I think I've got it here. So
I mean, if you look Dr. Posture on Facebook or look Dr. Posture on Twitter, you'll find it as well.
I'll post all the links to all those contact details as well.
Thank you.
And the app is just Dr. Posture, so they can search that in the App Store and be able to get that as well.
Correct. Yes. And if you want to use it on an iPad, you need to look into the iPhone apps.
Okay.
And it will work on your iPad, but it's on an iPhone app.
Okay, cool. Awesome. So that's going to be it for today. Thanks so much for your time. We've got some great information for the listeners to be able to help change their posture, especially through the manubrium lift and everything like that. So thanks again for that. If anyone has any questions, they can get in contact with you via your website and then go from there.
Thank you. Thank you very much. Thanks for having me.
Awesome. Thanks for your time. Thank you for listening to Chasing Gains Radio. Be sure to use the Chasing Gains Radio hashtag on all social media. If you have any questions, queries, or comments about the podcast, use this hashtag. Thanks again for listening to Chasing Gains Radio. Be sure to share and like this podcast to help spread the Chasing Gains movement.